Hi, welcome to the show. We have a great show today. We have Dr. Phil Harrington, who's the medical director of Summus Laser, and we talk about full body photobiomodulation. And there's a lot of talk these days about red light, about blue light, about ultraviolet, and what do we need to do and in the infrared space, even with saunas we're seeing, and what does that look like? What are the studies looking like? How can it benefit you? What are the health outcomes of people who are doing it more often? So I hope you enjoy. Hi, everyone. Welcome to Here for the Health of It. I'm Dr. Randy here with Dr. Tom, as always, and we have a great show today. We have Dr. Phil Herrington, who is the medical director for Summus Laser. And as many of you know, we are a big proponent of laser, of light therapy, of photobiomodulation, and this is his entire life, and he's here to talk with us about it. So thanks for being here.
I appreciate the invitation to come back. Great to see you guys. Great to see the clinic again and everybody. It's great to be here.
Yeah. So and this is your second time on here. We don't really let repeat guests unless they're very special. And the first time we talked a ton about the class 4 laser, which I know we're going to talk about as well.
Yep.
But since then, the Summus Vita light bed has come out, which is a state-of-the-art red light therapy, and even more than just red light therapy as well. And we're excited to kind of get into that. So I know it's been part of what Summus does is they're getting new technology and new things, and they have engineers working on different things all the time. So can you kind of tell us where the light bed came from?
Yeah, well, maybe first I do need to start with a little bit of a disclaimer. Okay. I am an employee. I'm the medical director for Summus Medical Laser, but anything that I say today is my opinion and my observation and feedback from clinics only. And I say that just because, so that we are staying clear of FDA issues, because all these devices are technically, they are unfortunately cleared as infrared heating lamps. They don't have a specific category for therapeutic laser devices. So when it comes to the company, we're very limited on claims that we can state. However, I'm here as an individual, and I will say, one thing that always goes in the back of my mind is it's okay to tell the truth, all right? And the truth is that there are published studies on the use of all of these light-based devices and the biological effects that they have, the mechanisms that they have, and then they are all being used clinically for a wide variety of conditions and health problems. And so when we talk about the Vita bed, the technical term for it is whole body photobiomodulation. And first off, photobiomodulation is the technical term for what we are doing here. We are exposing the body to light with the intention of having a positive biological effect. And I know that photobiomodulation is a mouthful. However, I'm not a big fan of the term red light therapy because these days there are many social media influencers that are peddling, which is quite frankly inferior equipment. And when we have our little seminar this afternoon with pictures and diagrams, I'll be able to show that much better. But just basically, units that are purchased off of Amazon or other things like that, the term is called irradiance or power density. It's a measure of the concentration of the light that is hitting the tissues. And first off, when you have light coming out of a light-emitting diode, it is non-coherent light. And so it's called the inverse square law applies, which means that if you double the distance away from it, you are getting 1/4 of the exposure. If you triple the distance, it's 1/9. And so with these panels that you can buy on Amazon or other things like that, especially the ones if you're just standing there or if you have something sitting on the desk in front of you, the milliwatts per square centimeter is at such a low level that it is really not going to have a positive biological effect. In order to have the true benefits, if you're going to do something, do it right. Rather than paying $500 for a cheap home use unit, it's much better to invest in coming to a clinic such as yours and getting that true whole body photobiomodulation. And where this whole concept started, it was a company out of the UK that I believe was the first in doing this, in using the light-emitting diode panels in a situation where the patient would lay in there and get this full-body exposure. Now, it is intended, it is best if you lay in there in your birthday suit, all right? You want exposure to all of your skin surface. And what's interesting is there's been some recent research coming out that shows the positive effects of that exposure of the light to the body.
Today's episode is brought to you by our sponsor, Columbia Family Chiropractic, with 3 easy-to-get-to locations, one in Forest Acres, which is by Trader Joe's, one in O'Neill Court by the DMV, and one in the Northeast by Sand Hills. You'll be sure to have somewhere near you. They offer a ton of services from corrective care, on-site digital x-rays, spinal decompression for bulging or herniated discs, dry needling for injuries, pediatric care, and a Class 4 laser. They accept all your major insurances. And if you mention this ad, you'll get a discount on your first appointment. Check out their website at cfc4health.com or Google Columbia Family Chiropractic. That's cfc4health.com.
Now, in the first whole body bed, they were using just one red and one infrared wavelength. Just basically, red is really nice for superficial conditions. Infrared can actually penetrate a little bit more into the body, and there's a real interesting study that just came out recently about exposure to infrared light. But what's important to know about that device and many other devices, going back to that irradiance, the concentration of the laser light is very low, but then also when they measure it, you have to measure it with what's called a photon spectrometer. That's the most accurate way to get the measurement. With those devices, the exposure is very low. Now with the Vita bed, we've had it measured with the photon spectrometer, and we are getting at least 120 milliwatts per square centimeter, which is a true therapeutic dose to the tissues in the body. So, first off, that reassurance that you are getting enough light. And one way to compare it is vision. We have nice bright lights in the room right now, but if we turned off all of the lights in here and then just had one Christmas bulb burning, that's not going to be enough light, and we're not going to be able to see.
Right.
So all biological processes in the body, you have to have an adequate amount of that in order to have a biological effect. So in the Vita bed, first off, the power density. It is, and it has been measured at where the skin surface of the patient would be. That is appropriate. And then secondly, in the Vita bed, we are using 5 therapeutic wavelengths. We're using 1 blue, 1 red, and 3 infrared wavelengths. And there are some interesting studies that look at the applications of those different wavelengths. So in the Vita bed, we do have 6 preset programs. So depending on your goal in your treatment, whatever health problem is going on with you or whatever your goal is, we will use different combinations of those wavelengths. Maybe sometimes we'll use all 5 of them together, but they do have specific benefits, just basically. The blue light, it's very interesting in that exposure to blue light at the appropriate power density does have a selective effect on killing harmful bacteria on your skin surface. So on your skin right now, you have a normal flora. You have beneficial bacteria on your skin surface. And, you can get into the whole skincare routine of making sure when you take a shower that you do not vigorously scrub with every shower that you take, because when you vigorously scrub, you are rubbing off that bad bacteria,
Right.
you're rubbing off the beneficial bacteria and, other skincare things. But with the blue light, it can selectively kill bad bacteria on the skin surface, which can improve the appearance of the skin. Very, very interesting.
Which I will say that when we first got the bed, someone came in. I remember one of our staff who was gone for a few weeks came in and was like, everybody's skin is glowing right now.
Yeah.
And that would be a lot of the 480 or lower wavelengths that would be
It's 450.
pushing that.
Yeah,
Or 450.
Yeah, 450. Yes, yeah. And it's important to note that the 450, it's in the blue. On your electromagnetic spectrum, you have the ultraviolet, which is the harmful, the ionizing radiation. That blue is non-ionizing, so it's short of that cutoff into the ultraviolet. So the blue, it is safe, completely safe to have exposure to that.
I have been asked that before because somebody asked me if they have sunscreen on, will it affect their ability to absorb the light? And then somebody else was wondering, should they put sunscreen on before going into the bed?
Yeah. Now, those sunscreens, okay, so anytime we talk about something like this, that brings up a good question. I would like to see a chart of the spectral coverage of a sunscreen product. I mean, it's advertised as protecting against UVA and UVB, but I'm guessing that there's going to be some blocking of the blue light. So
Right.
ideally, you want someone in the bed with clean, dry skin. Yeah. And then the red wavelengths, again, they will penetrate a few millimeters, and they have a beneficial effect on, collagen production, and it can reduce the appearance of some fine lines. If there is any minor damage to the superficial tissues, it can help with that. But what's really interesting is the exposure to the infrared light. There's a new study out, and what they are looking at is exposure to sunlight. And first off, you have to realize with sunlight that there are, beyond the visible, beyond what we see, there are also infrared wavelengths being put out by the sun. And what they found is when this infrared light from the sun, it will actually penetrate into our body. It actually does pass through light layers of clothing and will actually go into the body. And in this particular study, they looked at improvement of color vision. So in your eye, in the retina, you have the rods and the cones. The cones are the ones that are responsible for response to seeing colors. And in this study, they had a control group that got exposure to no light. They had a group that got full body exposure to infrared light. But then what was interesting is they actually took an aluminum shield and blocked their eyes. So only their body was getting exposed to the infrared. And what they found was that infrared light can actually penetrate into the body and stimulate the mitochondria. The whole big buzzword in the whole field of photobiomodulation is upregulating the mitochondria. The mitochondria is the powerhouse of the cell. We have trillions of cells in our body. And when we can make that mitochondria in the body more efficient, more active, it has beneficial effects throughout the body. And what they found in the study is when they exposed only the body to the infrared light, it actually improved their color vision, even though there was no direct exposure to the eye. So they're finding that the mitochondria will actually communicate with each other. Also, there are free-floating mitochondria in the bloodstream. So as the patient lays in there, getting exposure to this infrared light, upregulating the mitochondria, with that blood flow, you're getting that improvement in the mitochondria in the cones of the eye, and it improved their color vision.
Wow. And so I hear about different things, like the red light in the med spa space, for example, where they're putting the mask directly on their face,
Right.
and that would just be red light.
Yeah.
And then I've heard of the infrared stuff happens in the sauna world all the time, and you never really hear about them all coming together in a way that this has, where there's all the different wavelengths, but then also it's close enough to you and it's your whole entire body. Would you say that that's a unique thing that's happening, or was it somebody figured out the red light and then they were like, oh, we got to do red light, and then somebody else figured out the infrared stuff and they were like, well, we need to do infrared, and then put it all together into one place?
Yeah, well, going back in the history of photobiomodulation, it all started with exposure to red laser back in the mid-1960s when they shaved mice and then lasered them and found that the hair grew back more quickly on the mice that they shaved, and that was with red. And then they found that the infrared wavelengths specifically had an influence on the mitochondrial enzymes, the enzymes that are responsible for the production of energy in the cells. And then as time went on, they realized that these infrared wavelengths can penetrate deeply into the body. And so, yeah, that whole idea of making sure that you have the right combination of parameters to get the best outcome. Now, I'm sure that there are many people that put on those face masks, and they probably do look better. And I'm not gonna deny that. But when it comes to having a true systemic whole body health, if you're looking at improving your health and upregulating the mitochondria throughout the body, you simply have to have that whole body exposure in a bed with all of the wavelengths that we use.
And to be able to do multiple areas of your body instead of just one area.
Right.
Someone will tell me they wore the red light helmet for their hair and it helped them. And then another person will say, well, they wear the mask every night and it helps their skin and their collagen.
Yeah.
And then somebody else will say, well, I put it on my feet every night for my nerves, but they don't really do their whole body
Right.
with multiple wavelengths.
Well, wasn't one of our friends too like lifting up their beanbag and just targeting underneath there for testosterone?
For testosterone.
Oh, okay.
Is that
Okay.
No, I think he
Yeah.
he left his beanbag there because that's what needed the exposure.
Oh, okay. All right.
I guess he said if your testicles were exposed, your hormone like testosterone production would go through the roof, and he seemed to love it.
Okay. All right. Yeah. Yeah.
maybe helpful. I don't know.
It
Just
could be.
shine
Yeah,
a
I
light
do
on
know
it.
there are studies on sperm motility, that red light
Yeah.
can
I've
help
heard that
improve
too.
sperm motility.
Yeah.
And, a couple of comments there. First off, in typically in medicine, they really compartmentalize the body. You have the
Right.
ear, nose, and throat specialist, and the lung and they're looking at the body as a compilation of parts. Whereas in chiropractic, we tend to look at the whole body, and realize, if you're looking at things from a musculoskeletal standpoint, sometimes it could be a problem with the SI joint or the hip that is causing the foot pain.
Right.
And in our training as chiropractors, we're trained to find those things. And so it's kind of a similar way with using the whole body bed. Maybe you have one problem that only shows up in one area, but realize that laying in the bed is going to improve your overall health. And it's just going to make things repair better.
Nice.
That's good.
I'm curious in your guys' study of light, just in general, the negative effects of some of the light that we're just exposed to on the regular computer screens, cell phones, fluorescent lights, and how. I mean, you guys are studying the positives and looking for light wavelengths that help the body biologically.
Right.
What are some of the things that you guys are finding negatively from light?
Well, what I would say is that we are not getting exposed to the infrared wavelengths that we need. Like I just saw in 2026, they're going to be changing the regulations on LED bulbs. Now, everybody likes LED bulbs because they save energy, they last a long time. They're nice and bright and consistent. You don't have to replace them regularly like the old incandescent bulbs. But also, they are tightening the spectrum on the LED bulbs. So those LED bulbs will only be putting out, in the maybe some of the yellow and the blue and the green, and there will be no infrared coming out of the LED bulbs. In office buildings, or really any buildings, you put a coating on the windows to prevent the infrared light from coming in. So I guess what I'm trying to say is that if someone is inside nearly all day long, not getting any sun exposure at all, then they are not getting that infrared, that beneficial infrared light. And I think that's a good message for people. If you're just kind of dragging and down and don't have energy levels, strongly consider getting a series of treatments in the Vita bed so you do get that exposure to the infrared light to get that beneficial light.
So we're in your opinion, we're very, as a society, underexposed to light.
Yep. Absolutely. Yeah.
And then, but are you guys looking at the negative effects of screens or anything like that? Because of the blue blocker glasses and the things that are coming out to try, or the things on your phone that turn it to more orange light as it gets darker. Any knowledge on that?
Yeah, I think those are okay when it comes to vision and protecting. Looking at things like circadian rhythms and maybe let me try to tie this in. Getting that exposure to your cell phone or the blue screen from your TV too close to bed is going to interfere with your circadian rhythms and your sleep patterns. And one big interest of mine is Alzheimer's disease, neurodegenerative diseases. And, partly because my own mother did die of Alzheimer's. It was a horrible way to see her go. And, there's been different theories, throughout the years. People thought it was aluminum frying pans and, all these different things. And have you heard of the Bredesen protocol? No. So it's called the RECODE. So there's a doctor named Dale Bredesen that has actually published a study where they took 100 patients with cognitive decline and actually reversed their cognitive decline.
Wow.
That's totally unheard of.
Yeah.
Now, did he do it with one specific modality or one specific tool or one specific activity? No, it's really a multi-dimensional approach. And one of the big things is making sure that we have 8 hours of sleep every night. And so I'm not talking about the 75-year-old that is showing some signs of cognitive decline. I'm talking about the 40-year-old to prevent that from happening. Because when we sleep, there is a drainage system in the brain called the glymphatic drainage system. Now, we're all Palmer grads here. When I graduated Palmer in 1996, the glymphatic system in the brain had not even been discovered yet. I think it was in the early 2000s when they discovered this. So one of the best ways to make sure that your glymphatic system, it's lymph drainage for the brain, getting the garbage out of the brain. One of the best ways to keep that active is to get 8 hours of sleep, or 7, 8, 9, whatever it is that you need, but making sure that you have solid sleep every night.
Yeah.
And one way, going back to the Bredesen protocol, one way to do that is make sure that you do not eat 3 hours before bedtime, because the elevated insulin levels will cause blood sugar spikes and that sort of thing. You'll wake up at 2 a.m. You won't be able to go back to sleep because of that whole influence on the insulin and blood sugars.
Yeah.
So, this stuff, it really all kind of ties in together. So going back to your question about the light, I would say that, getting that exposure to the blue light too close to bedtime, that's going to interfere with your circadian rhythms, and you'll lose that sleep that you need.
Those would be yeah.
And then we talk a lot about dosage too.
Yeah.
And I know the laser world has been around for a very long time, incredibly studied. And I would say, if somebody comes to us and they have tennis elbow, or they have a problem with their foot or their knee or their back, like, we've done it so many times, seen it so many times, and it's been studied so many times that we know 100% what they need and what the dosage looks like.
Yep.
And the Vita bed is newer, and over time, we're starting to see that people with more systemic issues are responding well, and they're excited about it, and they're doing really well. So when a person comes and says, "Hey, Dr. Phil, what do I need to do frequency-wise in the Vita bed?" What kind of protocol is ideal, and then what would be the minimum effective dose for them?
Yeah, I think a good place to start, just in general, is going to be 3 times a week for 4 weeks. And if you're going to do something, you have to make sure that you're doing it consistently. Don't ever expect one time in the Vita bed to have an effect. However, the first time I laid in that thing, it was like that was a wow experience. It just immediately improved energy levels. But again, if anything in life, if you want to do it, if you want to get the improvement, you have to do it on a consistent basis. And so 3 times a week for 4 weeks is a real good starting point. And then, depending on your health situation and your health goals, likely you can taper off after that. But a good maintenance program is going to be once or twice a week. And of course, that also depends on what is your lifestyle like?
Yes.
Do you have an office job where you leave the house, you go to work at 8 or 8:30 a.m., you're in the office till 5, after work you do some things, and you do not ever get any sun exposure, then then getting that exposure in the Vita bed is going to help with that, getting that light exposure that you need.
Yeah, that's good. And to your point about the one time, I have a sister-in-law who came to visit once, got in there and raves about how much it helped her just that time she was driving through.
Yeah.
And I've heard that from many other people too, but I don't think you want to base a protocol on this person got better really fast. And I love the idea of at least 4 weeks. That's what your body needs to see big improvements.
And then also that there are finding it with some of these, with this whole body exposure, is that temporarily you can get an increase in lactate levels in the body. So if someone lays in the bed, it's very possible that a few hours later or the next day, they might feel achy and sore all over because of those elevated lactate levels. But then as they continue with the bed treatments, those lactate levels will drop off significantly and they will improve. So a phrase I like to use is, the pathway to recovery is not a straight line up. You're not just going to, immediately feel better right away. There can be some dips in there. And then also, if you do lay in there and you do feel sore afterwards, that's actually good news because it's showing that we are creating change in the body.
Yeah. Is there too high of a dose? We've been asked, can I do 2 sessions in a row or anything like that?
Right. Yeah. Right now, what we see and what the evidence shows is, of course, with the Vita bed, it's a 12-minute protocol. 12 minutes is enough. You do also hit a point of diminishing returns where, laying in there for 24 or 36 minutes, that you're really not getting any additional benefit from that. Right now, what we see is the 12 minutes is sufficient. Also, if someone does lay in there for 24 minutes, for their first few treatments, they might get somewhat of a detox reaction. That they might either be very sluggish, have flu-like symptoms, maybe have some loose stools or diarrhea. So right now we're saying that those 12-minute treatments are enough.
Nice. Yeah. Is there anything nutrition-wise that you found benefit the people that are getting light therapy that they could either take supplementally or put in their diet that would enhance the effects of the light?
Well, first off, I'm just going to say hydration.
Water,
hydration with good, clean water.
Yep.
I used to practice in rural Iowa, and now I know that your guys' patients listen to you and do everything that you tell them to.
Yep, and our wives.
And I remember this one old farmer came in and he was dealing with a back issue, and of course I'm a new grad, and I'm maybe I didn't know what I was doing either, but I said, Vern, make sure that you hydrate. And he comes in for his next visit. Yeah, I had 10 cups of coffee this morning instead of 5. So it's got to be hydration with good, clean water. Yep. Because, that consistent chronic dehydration, that leads to other problems.
Right.
So that would be number one. Secondly would be nitric oxide is so important for cardiovascular health. A couple of interesting tidbits here. I attended a lecture a few years ago from a nitric oxide expert by the name of Dr. Nathan Bryan. And one interesting thing, he polled the audience and he said, how many of you used mouthwash this morning? And about half the group raised their hand. And what he showed was that there is an absolute direct correlation between the American Dental Association recommending daily use of mouthwash with cardiovascular disease in the U.S.
Increases it?
Yes.
Wow.
And what they show is that the whole process of generating nitric oxide in your body, nitric oxide is a crucial component in your body for vasodilation, of keeping your vascular vessels open. And what you can do is you can actually take, and there's a study on this, they take healthy people and have, of course, your control group, and then they have some that will use mouthwash daily for just a week. And their blood pressure, even after just using mouthwash for a week, went up.
Wow.
Because of that effect. So in the process of chewing your food in the mouth, the beneficial bacteria in the mouth are what begins the breakdown of the foodstuffs into nitrates.
That's interesting.
And so I do use, so with my water pick, I will put some mouthwash in there like twice a month just to do a little deep clean in the gums, but I don't use mouthwash anymore. There's other things that you can do for good oral hygiene. So, nitric oxide, whether it is through making sure that you're getting a good amount of green leafy vegetables in your diet, chewing them well, but then also there are supplements, the beetroot supplements and things of that nature. Is it a beetroot powder?
I believe it is.
Yeah.
And I started taking it for even just for blood pressure, but also going to the gym. Like it's almost like a pre-workout to just keep the cardiovascular system ripping. It's great.
Yeah. And then just in general, first off is going to be nitric oxide levels. And there is a company that actually has a test strip. You can't eat for 30 minutes before using it, but you just put the test strip on your tongue. It'll measure your body's nitric oxide levels. But then another one in general, when it comes to any type of photobiomodulation, is going to be ubiquinol, which is the reduced form of CoQ10. That is so important for your body's production of energy.
Mm-hmm. And a lot of people don't know, if someone's on statins, that stops their body's ability to make CoQ10 because of the process.
Right. Yeah.
So anybody with statins should be automatically supplementing with CoQ10 as
Absolutely.
well.
Yeah.
All right. And then what about what else in the study and science world are you finding that you're excited about right now?
Oh, boy. Well, so one thing is just getting more and more evidence for photobiomodulation. Mm-hmm. I've been doing this for 20 years. And when I started doing this 20 years, people would always ask for white papers on this and white papers on that. Mm-hmm. And if there was a white paper for every question that they asked, that'd make my job a heck of a lot easier. Right. But what I like is that there are, published studies are showing up in more high-impact journals. You're getting, Nature, Science, all these sorts of things are publishing studies on photobiomodulation. The general awareness of photobiomodulation is increasing. And, anywhere from the cellular mechanisms, so we can describe how it happens to the the effects on various conditions in the body. It's very exciting. Yeah.
What places are doing most of the studies? Like, is there schools that are leading the forefront for photobiomodulation?
Yeah. Well, yeah. There are places around the world that are doing studies, and I guess just realize that most of these studies are either self-funded or funded by a company, whereas most of the drug studies are funded by the federal government and the drug companies. So one uphill battle that we face in photobiomodulation is resources. Yeah. It's very expensive to do studies, but I'm also encouraged by the various conditions that we see benefiting from photobiomodulation, whether it is the bed or the laser. A very popular topic lately is the use of the laser for pulmonary fibrosis in the lungs. And I don't know if have you guys had any patients with lung conditions?
Lots. Yep.
Yeah. So it's, a couple of things there. Of course, in a chiropractic office, we're not managing the lung condition. And quite often we are getting a prescription from a pulmonologist for the laser therapy treatments. But that whole story was interesting, is that in 2014, a chiropractor in California named Dr. Andy Hall was diagnosed with pulmonary fibrosis and there was no knowledge of use of laser for pulmonary fibrosis before that. And so they told him, hey, Andy, in 5 years, you're going to be dead. He's like, well, I've got nothing to lose. I'll grab my laser. And he starts lasering himself.
Right.
Good news is 11 years later, he's still alive.
Wow.
His pulmonary function tests improve, and he's actually developed specific protocols for lung conditions. And there are dozens, if not hundreds of people around the world that have benefited from it. So, the laser is not targeting a specific condition. And I think we always have to draw that distinction. The laser is just creating healthier tissues.
Right.
It's managing inflammation. It's increasing tissue oxygenation. You're getting more energy produced by the cells. You're just helping the body to heal itself.
And differentiate again there's these class 2 lasers and class 3 and class 1.
Right.
The class 4 separates itself, but I don't think the average patient, I've had, my father went to a doc back in where we're from in Erie, and the guy just gave him a class 2 laser to take home. And I thought that was just going to do absolutely nothing. Yeah,
it's just going to be just simply the dosage. So the class level, basically, it's the power output of the laser. Power is the brightness of the light, which over time is going to give you the dosage that you can deliver to the tissues. And granted, maybe sometimes doing that does work, but when you want to have more consistent results, it simply has to be a class 4 laser, because everyone always talks about all these different mechanisms in the cells and the mitochondria and the cell membrane and all these different things. Well, in order for that to happen, you must have a happy little photon of light hitting that cell.
Right.
And with that class 2 device, if you put it in one spot, you're getting a little exposure on that spot. But with our class 4 device, we're able to get exposure to all of the tissues.
Right, gotcha. And penetration too, right?
Penetration in a safe way.
Yep.
Yes.
Yep. Now, do you see any studying of other colors on the spectrum? I forget what it's called.
Yeah.
It's like they put these, like you could do dosages of yellow light or orange light or purple light, and there's different benefits that it's supposedly
Roy G. Biv.
Roy
the
G.
whole
Biv.
thing.
Right.
Do you see any of the other
deep purple?
colors?
Give me a flashback. When I was in Copenhagen a couple of years ago, my last night was free. You know Deep Purple, don't you?
Yeah.
They are like the original heavy metal band.
Oh yeah.
Or do you know they're
My dad was a DJ back in the days, but I
you know
never
their-
listened.
you know
I never
their number
listened.
one song?
No.
Dun, 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 dun. Smoke on the Water. So I walked into this venue in Copenhagen, and I walked up. I didn't have a ticket. It was $85. I'm like, what the heck? It's Deep Purple. And these guys from Denmark, hey, they saw I was buying. They gave me a free ticket, and I was by myself, so I was able to walk and be in the front row. So I stood in the front row for Smoke on the Water.
That's sweet.
Yeah.
That is.
And they were dosing you with purple light.
Oh yeah.
Purple light.
Yeah, it was awesome.
The Red Deer Rebels, where I grew up in Red Deer, Alberta, that song was the one that they came out onto the ice to every time.
I love it. But yeah, the different colors of light, the key thing is going to be the penetration into the
Right.
body. So if you really truly want to do photobiomodulation, you must have photon being absorbed by cell. So I know there are some people looking at green, possibly. The thing with green is horrible at penetrating. Now, if you're looking at penetration, getting light into the body, green is a horrible choice. There might be some other mechanisms that are happening at the body surface, whether it's our body's energy field or acupuncture points. So it's not going to be the same mechanism that we're talking about with the bed or with classical laser therapy. There might be some other mechanism there, but they haven't explained what that mechanism is.
Gotcha. Okay.
But then also there was, actually they're still around, there's a German company that actually does intravenous blood irradiation. So you actually stick a cannula, stick a needle into your veins, and actually you directly shine the laser light on the blood. And they have a whole protocol developed. They have I think it is 7 different colors of laser. So they will use blue and purple and orange and yellow for different conditions.
Put it back in.
No, it's you're just lasering the bloodstream. So no blood is coming out. You're just sticking a laser needle into the blood.
Okay. That's interesting.
That's interesting. Yeah, because I do hear about people taking blood out and then using
oxygenating.
Yeah, oxygenating it, using light on it to kill bacteria, and then putting it back in.
Mm-hmm.
It seems like it's getting pretty popular too. I think it's called a blood oil change. Is that what you've been hearing? I've been hearing about it, but
Jiffy
I don't know
Lube.
much about it. Yeah.
Jiffy Lube for your bloodstream, 5-minute service.
That's I was going to ask about the pulsing portion of it because that's unique. Most people haven't seen that.
Mm-hmm. Yeah. So the flashing of the light is a whole interesting and there are studies that take a look at this and looking at the mechanisms. Going back to the 1970s, there was a Russian physicist named Tina Karu that did a lot of work on this. And what she found is when she exposed cell cultures to different pulse rates, they respond differently. I mean, that's just kind of the summary of it. So whether you flash it at 10 times per second or 100 times per second, you get a different outcome. But then also, if you take 2 different cell types and expose them to the same pulse rate, they act differently.
Really?
So there has been knowledge of this ability of the pulse rates of laser and also with the bed that you will get somewhat of a different physiological effect. One interesting application of this is that if you use the class 4 laser over the brain, which is safe to do, and you use it at different pulse frequencies, you can actually stimulate the production of different brain waves. Wow. So you have the different, and I'll talk about some of this afternoon. Yeah. You have the different brain waves in the body, alpha, theta, delta, theta, et cetera. And depending on what the presentation of the patient is, if you use different pulse frequencies, it can have a beneficial effect. So for me, when I'm at home in my office with my laser, my daily routine is I will start out my day. I use 40 hertz because that is shown to stimulate theta wave production, which is that higher consciousness, improved thinking abilities. So I have that, that real good productive time in the morning. And I do feel it makes a difference. I didn't use it this morning, so if I'm off my game, I should have borrowed your laser.
You're crushing it.
But that's, so we have some chiropractors that are using it. His name is Scott Haggerty in Ohio, that is using it for various brain-related conditions in children, autism, ADHD, other developmental disorders, anxiety, things of that nature, and just finding that if we use the laser on the brain, it's going to help stimulate that brainwave activity. So that whole aspect of the pulsing has that effect. But then also, throughout the body, what we find is that the different pulse rates will have different effects depending on the condition and the tissues affected in the patient.
Nice. So it's not really the depth that it goes, it's more how the cells react to the pulsing.
Right. Yeah. And one phrase that Russian physicist said is that you pulse the light, you impart the light to the cell, and then it's actually during the dark time when the pulse is off that the reactions happen. Yeah. So the good stuff happens when the light is off.
Yeah,
interesting.
It's good.
That's a good point. Yeah.
Trying to tie that into a previous
So,
topic.
yeah, that's good.
But and that's just draw a distinction in class 4 laser equipment. A lot of the class 4 laser equipment that chiropractors are using is primarily continuous wave. And granted, it'll probably help, but if you want to do a better job of it, then having that ability to pulse is critical. Yes.
Most people who have been to somewhere else before and come here, when they see it pulsing, they come and ask, is it supposed to pulse? And we always say yes.
Absolutely.
And it's because it stimulates different things than just continuous waves.
Yep. Maybe I don't know. We'll see if this is a good analogy. If you go to a buffet, are there good?
I haven't been to a buffet. in a
I'm
decade.
terrified of buffets.
Are you? Okay. Well, imagine when you were a college
good
student and you went to,
buffet. Yep.
if you hit a good buffet, you don't just go and get the fried chicken. You get everything.
dabble.
You want everything.
That's
so,
true.
So with the laser, we're kind of giving the body a laser buffet of photons.
Love that.
Nice. Now, I get in the bed sometimes, no eye protection. And I know that probably Summus can't state. So, in your opinion, is that just still fine? Because I want the laser going through my eyelids, or the red light,
Right.
And-
yeah. Well, I guess, for yourself, probably okay. How many fingers am I holding up?
3, 1.
But from a liability standpoint with the
You just
patients,
can't.
I wouldn't do that. Yeah.
Right.
So, but at least getting the eye cups on. Now, what will happen is they'll have the eye cups on, so they are not getting the direct exposure through the lens. However, you are still getting some
Around
light
it,
coming
yeah.
in around,
Yeah.
and that's entirely safe. That's entirely okay. And kind of going back to that recently published study I was talking about, where they exposed the body. By doing that, you are still getting upregulation of the mitochondria.
Yeah.
So 2 weeks ago, I was in a chiropractic office, and the chiropractor there said that he's been using the bed regularly. And he said one thing that he noticed, along with everything else, is when he walks from inside out into sunlight, he doesn't have that glare, that Brinkley effects, that his eyes accommodate much more quickly.
Yeah. I never wear sunglasses either. Like that's always been a kind of a thing for me. And so maybe that has something to do with it.
Just to touch on that, my very first time hearing about red light was from my brother, probably 10 years ago, when his friend got a red light machine for their dad who had Alzheimer's, and he was getting worse. They said, we've seen some studies on this, probably the same studies that you were talking about, and they said, Dad, you just have to put this on your head every day and do it. So he would lay there, and after a few weeks, they noticed his dad wasn't putting his glasses on. He was walking around with his head up, and then they asked him, like, are you not wearing your glasses? I don't need them. And then he said, and actually, then as they dug more into it, he wasn't putting his glasses on at all. He was laying there staring straight into the light.
Wow.
And they said that his glasses were better. Not that we would recommend that, but I remember hearing that story and being like, wow, that's exciting.
Yeah. Interesting. Very interesting. Yeah.
What about pregnancy? I know, again, liability wise, can't, that'd be, I guess maybe speak to who shouldn't get in the bed, just liability wise. But then if they got the back door and it's me using it,
right.
Sounds like it's like anything goes.
I've got 2 daughters. If and when they're going to be pregnant and I'm going to be a granddaddy, I will not hesitate. I would use the laser on them. I would put them in the bed.
Yep.
And that's always been a liability thing because, the baseline rate of miscarriage is about 15%. And then also the baseline rate of birth defects is 3%. So if either of those things are used and something bad happens, then what would happen?
Right.
One encouraging thing is that, first off, to the best of my knowledge, and I do keep my finger on the pulse of things, I have never heard of a malpractice lawsuit involving, use of any light-based therapy and a pregnancy. Secondly, I know the depth of penetration of laser. I know the physiological effects of laser. Laser is not going to cause a problem.
Right.
Yeah. Third is there was a study recently published in Australia on the use of class 4 laser, the entire patient population, pregnant females with carpal tunnel syndrome. Yeah. So they are actively using class 4 laser on pregnant women with carpal tunnel syndrome. No adverse effects. Yep. And then also, I remember years ago at a laser conference in Europe, I heard of people who would intentionally used the laser over the gravid uterus, and their intention was to improve the health of the fetus.
Sure.
So I know that, from a malpractice standpoint, we have to make sure that we're very, very careful there.
Yeah.
But,
Well, because I just think light makes so much sense. And the fact that if you just go animals, they're not wearing clothing. They're exposed to, you know what I mean? and they're an outdoor. We just aren't getting any of that. And then that's what led me down, because we had a guest on that was talking about sunlight in their butthole. And it's just so true when you start thinking there are parts of your body that you just don't ever get exposed. There are people probably their entire, or maybe not entire life, but decades of parts of their body, no direct light exposure, which is wild to think about.
Yeah.
And it shows why this Vita bed is such an important thing to get your dosages up, and just the sheer exposure. When I'm in there nude, I'm like, this is great, and I don't know why.
Yeah.
But I try to get every part available.
Yeah, you are getting the optimal dose by getting that direct exposure to the skin. Going back to that earlier study, they did show that from the sunlight, some of that infrared, around 850 nanometers, which is a wavelength in the Vita bed, 850 nanometers, does actually penetrate light clothing. So the things that we are wearing, you do get a small amount coming through. So I don't want anybody in the Columbia area. I don't want a spike in arrests of public nudity happening here. And they go, I listened to this podcast and told me I have to walk around in the sunlight naked. No, you don't have to do that. You just light clothing and exposure in the sun.
Yeah. Wow. And then what's the number of bulbs, just perspective wise, that are in the bed that you guys have, and compared to maybe the wall unit or the masks or?
Oh gosh, it's so much more. I don't have that number committed to memory, but it's the thousands. I guess I would just go back to that number of 120 milliwatts per square centimeter. So that there are two other very popular beds on the market that they, and I'll talk about this afternoon, they advertise a certain number. So in their product brochures, they show this number, but then a third-party independent tester came in and they found that it was much lower with those other. So if someone is doing this whole body photobiomodulation, I know that fitness centers have these things and other places are popular. Yeah. And then especially if you're standing there, you are simply not getting the exposure.
Gotcha.
Yeah,
good.
That, and then as far as the future of photobiomodulation, what are you seeing coming down the pipe?
There's going to be other uses of laser, maybe some consideration of whole body laser treatments. That's an interesting concept. There also is an application of robotic laser devices, and really kind of ties in with this whole growth of artificial intelligence and that sort of thing. So, you definitely, when you're doing a class 4 laser therapy treatment, it is absolutely best to have it done as an attended modality where you are actively shining the laser light on the tissues. And so, at this point, it does have to be done by a laser technician. There could be some applications where it is okay to have a robot do that. Right. And I'm not talking about something that looks like a microphone stand and it's just kind of wiggling back and forth. That's not a robot. I'm talking about a true fully articulating arm robot that has thermal camera imaging, the full sensors in there, so that it is fully robotic arm, that sort of thing.
Sweet.
Yeah,
I'm excited about the thermal side of it too, because you could look at a person's spine, back, shoulders, and actually see the areas that are inflamed. And then you would have a very good idea of the range where you need to be and what you need to do.
Yeah. And it's a nice patient education tool to show before and after the treatment how things have changed. And that's, I think that's especially effective with neuropathy patients when they have the poor circulation in the feet, and you show them how blue it is on the thermal imaging, and then you do the laser treatment, and they can see, even if they don't feel symptomatically, they can see that red, we're showing that we are getting circulation in the foot and the toes.
Yeah, that's a good point. We should just touch on neuropathy for a couple minutes, because Columbia, I was told by my friend, he was a nurse. This was probably 5 years ago when I first moved here. He said Columbia was the capital of below-the-knee amputations in the entire country. The most people from amputations from generally diabetes, but also it could be injury, it could be chemotherapy, it could be idiopathic. And I think there's this idea in the medical world that we just give them drugs until they get amputated. But what we're seeing is that there can be a lot of benefits to photobiomodulation.
Absolutely. Yeah. Yep. And that's going to be, a little bit more of the information, fresh information that I shared this afternoon to show under live blood testing. You can show, normally the red blood cells in our bloodstream, they should actually naturally repel each other. And that's just going to help with blood viscosity. So the blood flows more freely in the body. When you eat sugar, those red blood cells tend to agglutinate. They tend to stack up next to each other. They stick together. And so the blood is going to be more viscous. It doesn't flow as easily. It also cannot carry oxygen and nutrients as well. And when we apply the laser to the area, one way that it helps is to get those red blood cells free again. So the use of laser therapy for neuropathy, diabetic neuropathy, it really has been a tremendous benefit for all those neuropathic patients. And, I can definitely state without a doubt that we have cases where the patient was scheduled for an amputation, and with the laser treatments, they canceled the amputation.
Amazing.
And I don't think we really, it's sometimes hard to wrap your head around how powerful that is. Amputation, lifetime healthcare costs is more than $500,000. Mm-hmm. And then you think about the effect on their quality of life and all the people around them. It's horrible. And then also when they do have the amputation, they're going to have residual limb pain and phantom limb sensation. Their life isn't going to be better just because they get the foot chopped off. So, but then also when they have the amputation, if they do have it, the class for laser therapy treatments can help with that residual limb sensation. So, it's we just need to. You have to, when you do look at healthcare, you have to start with non-invasive methods that are still proven. And class for laser therapy for peripheral neuropathy is a proven solution.
Mm-hmm. That's great. Well, this has been unreal. This is a lot of information.
I'm excited for this afternoon.
It's exciting to see all the new technology that's coming out, the studies that are catching up to the things that we've known and we've seen clinically as well.
Right. Yeah, absolutely. Yeah.
All right. Appreciate it. Thanks for listening.
Here
We're here for the health of it.
for the health of it.
Just a quick note, this podcast is for informational purposes only. We're not meant to replace your doctors, and nothing here should be taken as medical advice. Always check with a qualified professional before making decisions about your health. The views and opinions expressed by our guests or hosts are their own and do not necessarily reflect those of this podcast. Reliance on any information provided is solely at your own risk.